Welcome to WorldatWork Research in Brief. I'm Ryan Johnson. Today the topic is workplace wellness, and specifically a survey that was conducted by Buck Consultants with the assistance of WorldatWork in 2009 on workplace wellness. And I'm joined today by Barry Hall, who is the Global Practice Leader for Wellness and Research and Consulting with Buck Consultants. Thanks for joining us, Barry.
Thank you, Ryan.
First of all, there's a lot of definitions about workplace wellness. Why don't we start there? How did you define workplace wellness for the survey?
Well, you're right. Wellness has different meanings in different parts of the world, and since this was a global survey, we did have to be clear about what we mean by it. It's programs that are designed to improve the health of employees, sometimes also the employees' families, improve the health and well-being of them. So it's not just about physical health, but about mental health, in some cases financial health as well. And they're not just totally altruistic programs. From the employer's standpoint, they're also expecting that they're going to improve the performance of the organization and, to some extent, reduce costs as well.
Okay, Barry, given that definition then, let's talk about the prevalence of some of the workplace wellness programs that you discovered in the survey. And we should note, and you already said it, this was a global survey, correct?
That's right. Wellness is a global issue for employers around the world. It's most prevalent in the U.S., where 75% or more of the responding employers indicated that they offer some sort of wellness program. But it's pretty consistent around the world, and there are some specific countries and areas where wellness is really booming, in addition to the U.S., areas such as South Africa, Singapore, Brazil, UK, other parts of Europe. So it really is a globally, a phenomenon of global interest to employers.
Barry, obviously companies engage in workplace wellness for a variety of reasons, but what were some of the specific things that we learned from the survey about why companies are engaging in wellness programs?
Well, the number one reason worldwide that employers are investing in wellness programs is to improve the productivity of their workers and reduce what's called presenteeism. Presenteeism is a relatively new term that identifies lost productivity due to employees not being at their peak health. And so employers would like to impact that, and that's the number one reason worldwide. Number two reason is absence, so keeping employees healthy, keeping them at work because they're healthy. Now, having said that, those are not the top two reasons in the U.S. The number one reason in the U.S. is reducing healthcare insurance costs. As I'm sure you're aware, it's a big issue, a big pain point for U.S. employers. In the U.S., unlike most other countries in the world, employers pay as much as 75 or 80% on average of the cost of healthcare for their workers. And the cost of healthcare in the U.S. is among the highest in the world. So that's a sort of a competitive disadvantage for employers in the U.S., and it's a pain point. And it's something that having healthier workers can actually reduce that underlying cost. So in the U.S., that's the number one reason. Presenteeism and absence are numbers 2 and 3 in the U.S., but they're kind of a distant 2 and 3 compared to the rest of the world. Now there are, within the survey, there were 12 different potential reasons that were ranked, objectives by employers. So those are sort of the top 3, but there are a lot of other ones. Retaining and attracting and retaining workers, improving morale, supporting the company's brand or image, community support.
Barry, what were some of the top health risks that companies identified in the survey that they're trying to mitigate through wellness programs?
The number one issue, health issue worldwide that employers are investing in to deal with is stress for workers. And understandable, especially in these times, there's a lot of stress going on. Now, I said that's the number one issue worldwide. Again, in the U.S., we're a little bit different. That was number 5 in the U.S. And in the U.S. and Latin America as well, the number one health issue is physical activity, increasing the amount of physical activity that workers get. And number 2 was nutrition, improving nutrition. So as you can imagine, those are kind of targeted more at dealing with obesity, which is an issue in the Americas, obviously. And stress is not as important an issue to U.S. employers. It doesn't mean the prevalence isn't there. It just means that the focus is a little bit different. Might be understandable because, as I said before, U.S. employers are focused on reducing costs of healthcare. And if you look at obesity as their key target, that's a bigger impact of healthcare costs leading to heart disease, diabetes.
Now, one of the difficult issues I know always with wellness programs is measuring that return on investment. So where do we stand in terms of ROI these days, and what did the survey reveal about it?
First of all, the majority of employers worldwide are not measuring ROI right now to the extent that they would like to. It depends on which type, and there are a number of different metrics you can look at and what part of the world you're in, but it could be anywhere from 50 to 75% of the employers said, we don't know. If we look specifically in the US, about 58%, more than half, said we're not measuring it currently, but then 24% said we are measuring it and we've had a reduction, and then the remainder, I think 18%, said we have measured it and we're not seeing a reduction yet. So we've got about a quarter of the US employers saying it's having a positive impact. And then we asked a follow-up question to them, how many percentage points have you reduced your trend by? The average was 2 to 5 percentage points. Now, at first glance, maybe that doesn't sound like that's a lot of return, but if you think of an employer, for example, with 10,000 employees, they're probably spending somewhere around $100 million per year on healthcare costs. If they can reduce that trend by even just 3 to 4%, that's $3 or $4 million per year.
So it seems in general, though, that the ROI question is somewhere that's fertile ground in the future for companies to continue to pursue. Just looking into your crystal ball, Barry, what other trends do you see from the survey, or just your own personal view on trends for wellness in the future? Where's this headed?
Some of the leading edge companies are looking at wellness as really kind of taking it out of the benefits world, or thinking of it as a benefit program, which is where it originated for a lot of employers, and saying this is not just a component of our health benefit program or strategy. This is a business strategy. This is a business issue, because it's about not only about our costs, but it's about our competitiveness, about our productivity, and a recognition that healthier employees, healthier, high-performing employees drive a high-performing organization. And that brings it right up to the C-suite level. Are we performing at our peak as an organization, recognizing that our employees are a key component of that, and their health is a key factor in how well they're thinking, how alert they are, how they relate to not only to their coworkers, but to our customers. So employers are now saying, how do we think of this as a business initiative? How do we budget for that? How do we develop a business case for investment? How are we going to measure this over multiple years, looking at a multi-year strategy? It really kind of takes it up into a new realm for wellness as a business issue.
Well, Barry, I want to thank you for coming in today and talking about this new wellness data.
Thanks, my pleasure.
And of course, if you're interested in the full results of the survey, you can find those on WorldatWork.org. I want to thank Barry Hall from Buck Consultants for coming in to talk about wellness in the workplace. And for World at Work Research in Brief, I'm Ryan Johnson.